The topic of this presentation is minimally invasive esophagectomy. In this lecture, I will talk about the characteristics of two histologic types of esophageal cancer. Esophageal cancer is well known for high malignant potential and poor prognosis. There are two histologic types in esophageal cancer. One is squamous cell carcinoma, and the other is adenocarcinoma. Let me introduce staging system for esophageal cancer based on the 8th edition of AJC's cancer staging system. For clinical staging, T, N, and M categories are needed. When tumor is located from cervical esophagus to lower border of the azygos vein, classified as upper.